We'll take a break now. Sunrise Today will be back. Please stay with us.
Well, the issues are not going to handle themselves. That is why we are humans. We are created to solve problems. And one that is literally facing the entire world and holding us all down is COVID-19. And it's a pandemic, one that's definitely crippled many, many economies all over the world. Are we getting to the end with the talk about the vaccines all over the place now? Well, to have this conversation, we have a lady and a gentleman with us, two medical practitioners. Dr. Tolu Olufunlayo is a consultant public health physician. She is chairman Association of Public Health Physicians of Nigeria. She is the chairman of the Lagos State chapter. She joins us virtually this morning. Thank you very much for joining us. And we'll also have with Maokwa in Abuja, Dr. Akiala Ishaku. He's a virologist, public health epidemiologist. Thank you very much for joining us this morning. But let me begin with Dr. Olufunlayo. Well, we have crossed the 100,000 cases mark, and it definitely is something that will give anyone concern. But then it is at the same time where we have expedited a lot of conversations on vaccines. Yesterday, even this morning, a good number of the newspapers are looking at the solutions, the approaches to vaccines. Federal government has budgeted 5.8 billion naira for vaccine institutes. Meanwhile, we have a national vaccine production laboratory that hasn't worked in so many years. And all of this is going on, and the federal government is having conversations with the private sector. It's all a whole lot of conversations. Is there any hope in sight anytime soon?
Well, good morning, Ayo, and thank you for having me. Definitely, as you said, we are humans and we are created to solve problems. The issue is that we must have strategies that work. And from time to time, we must go back and review our strategies to see whether or not they're working. Now, this virus, as we have been saying over and over again, does not move by itself. It requires humans to move. And so one of the key areas for prevention and stopping this pandemic is actually the control of human behavior. And as we all know, that is one of the most difficult things to do. It's not just in Nigeria that we are having this problem of control, but in Nigeria, it's peculiar because our health and other systems have been so weak prior to the advent of the pandemic. And so this pandemic has just exposed the weakness of our health system. Also, you're right that we have crossed a sad landmark of 100,000 cases. But it's not all bad news in the sense that God so kind, we have been spared from having much higher cases. If you remember when the pandemic started, when we were in the first wave, the predictions from modeling showed that we were going to get to about 120,000 cases by the middle of the year. So thankfully, we are just getting to 100,000 cases. But on the other hand, these numbers are now becoming names, and they are names of people that we know about. So just one number for whoever knows that person is an issue. So yes, vaccines are important in, preventing a pandemic spread of an infectious disease, and we must look at how we can enhance our capacity, in terms of vaccines. But the truth of the matter is we really don't have everything that it takes right now to invent and manufacture the vaccine. It's not about just getting the vaccine together. That is being worked on in some of our institutions in Nigeria. But the greater issue is the production. It requires a very high level of capital and logistic resources that we yet have. I was very happy to hear on the news yesterday that Ekiti State, for example, was building up its cold room, logistics, ordering a high level number of freezers. And that's, a step in the right direction. These are the things that we should be doing at federal, state, and local government level. We must build our capacity, not just for coronavirus, but for all infectious and other diseases. We must strengthen our health system. Now, coming back to the end in sight for COVID-19, we cannot move away from the non-pharmaceutical interventions. We must emphasize that we're not doing them enough. We need to emphasize physical distancing, wearing of face coverings when we're in public places, and of course, frequent hand washing or use of hand sanitizers, as well as cough etiquette. These are some of the most important things that we need to do to be able to curtail and mitigate this pandemic, and then begin to see a reversal in this upward trend of cases.
Well, doctor, when you talk about human behavior, I think you are not the only one, because you also remember the PTF COVID-19 chairman also listed 4 factors responsible for the rise in cases. All of them human behavior related. Increase in local and international travels, business activities have resumed and increased, the Yuletide, religious activities, as well as the reopening of schools. And that is something that is giving a good number of people the goosebumps now. Even the Minister of Education has said there might be a need to review the resumption that has been proposed. If we are to control human behavior, that delicate balance of lives and livelihood is a really difficult one. What would you propose? Because it's going to be really difficult to control human behavior, especially when livelihood is concerned, particularly for a climate like our own.
Well, you're so right. It's a catch-22, really. And as you pointed out, in our own environment, with more than 2/3 of the population being daily earners, it's very difficult for us to start thinking of a second lockdown unless it is absolutely necessary. But you see, one of the things that most of my colleagues and I have been harping on from the beginning of the pandemic is that we need to embrace a do-with approach. We need to get the community, the grassroots, the individuals in their communities more involved. If they're more involved, then there'll be some level of a buy-in, at least by a higher proportion of the population, and we may begin to see some changes. The other thing, of course, is our risk communication. In the beginning of the pandemic, little was known about this virus because it is a novel virus. And so maybe we didn't quite get it right. The picture that was painted to Nigerians was of one that, didn't quite fit what we then saw in the beginning. And that made a lot of people think that, we were just telling tales. And this is the reason why you hear people saying that COVID-19 is just glorified malaria. Please, COVID-19 is not malaria. It is not malaria, and it does not have a treatment. That is the reason why we need to, as much as possible, prevent it from spreading. Because once it spreads, it just depends on, the individual and how it's going to manifest in the person's body. So the issue now is that we need to engage more. We need to work harder, not just at the top, at the management levels, but we need to go down to the people and let them embrace this message. Let them understand that we actually do have a problem with us. And then maybe we'll begin to see more changes. Now, some of the previous issues we had with infectious diseases and some immunizations, until we engaged with communities and got them heavily involved, it was difficult to see these changes. So this is where we really must, I think, put a lot of our effort at this point in time. Yes, we need the infrastructure, we need more testing, we need, more facilities, because right now our facilities are quite overstretched. I think, our capacity to support people who have critical cases of COVID now is stretched, but we also need to go to the grassroots to make sure that we prevent this thing by modifying human behavior. And that can only come when people buy in to what we are doing, to what we are saying, and actually accept the fact that COVID is an illness that needs to be stopped in its tracks.
Well, Dr. Ishaku, just before I hand you over to Mark, where there is this issue that, Dr. Olufumlayo mentioned just now, and that is the fact that we need to strengthen our institutions, especially in terms of producing vaccines. You would remember that we have such a thing as the National Vaccine Production Laboratory that even before the 90s, that was supposed to be ahead of such a thing as this. An attempt was made in 1991 to revamp it, but never really saw the light of day. In 2017, there was an agreement between the federal government and a private organization for the production of vaccines. It was only November last year again that we heard that the Minister of Health signed an MOU with that particular organization for the production of vaccines. And you remember also that the WHO has told us that another pandemic is in the horizon. How soon, no one knows yet. But we are still struggling with this one at this time. Talking about getting ahead of anything, do you think we have that capacity? And do you think we have the wherewithal to take that on right now?
Thank you, Ayo, and compliment of the season. Thank you, viewers, for tuning in. As a country, I think we have the capacity to actually go into vaccine production. It's the political will that we need to have now as a backing. So there is a federal vaccine laboratory in Yaba that was established in 1925 by Rockefeller Laboratory. They started producing smallpox vaccines and then migrated to the production of yellow fever vaccine in 1930, 1952. Thereabout, Nigeria was certified by WHO through PAWOSU to actually produce vaccines, yellow fever vaccines for sub-Saharan Africa and West African countries. We lost it in 1991, and then, a lot of our best brains have retired now. A lot of our mentors have retired now. Ayo, let me share this with you. I think I was on this station 5 months ago, and I listed some quite Nigerians that are doing very, very well in terms of vaccine development. The guy that is leading Pfizer, the guy that is leading Moderna vaccines for COVID-19, they are all Nigerians. So we have the capacity. We have a lot of vaccinologists in-house. Redeemer University, there through the African Center for Excellence, have actually modeled out COVID-19 vaccine of the DNA model. And I think that all what they need now is support. So we have a lot of vaccinologists. We have a lot of classical virologists in-house that we need to actually harness these human resources and begin to bring them in. So not only to COVID, what happens to Lassa fever? So are we thinking of Lassa fever vaccine? Are we thinking of producing yellow fever vaccine in-house? Let me give you an example. India is doing classically well. In fact, India has been outsourced to produce COVID-19 vaccine through the AstraZeneca, the Oxford AstraZeneca. So virtually all the vaccines, the childhood preventable vaccines, are being produced in Africa, in India, I mean. If you go to most of our pharmaceutical stores, a lot of drugs are coming from India. So what I expect the federal government to do, yes, are buying into setting up vaccine institutes. That's a welcome idea. I buy into the, money, billions of nairas that have been voted out. But I think we need to also see to how we can be able to harness human resources. We need to also see to how we can also build capacity. In my thinking, when I was driving in this morning, I was thinking that the Ministry of Foreign Affairs, time has come for them to look at the Nigerian best brains across the globe. And can we have a presidential welcome back home to most of these guys? Let us see to how we can be able to tap into this. open a window for them and see how they can be able to contribute. Let me share something with you that will amaze you. I was privileged to do my postdoctorate degree in the Netherlands, and I ran into most of my laboratory assay in 6 labs that are into Lassa fever vaccine development. And I asked one of the principal investigators, we have Lassa fever in Africa, so why is it that you will not set up most of this lab in Africa? And he laughed. We have the vaccines here, we have the disease here, but how many research have we done in terms of Lassa fever vaccine development, in terms of yellow fever vaccine development? So you could see that we have the disease here, but the vaccines are not being produced here. They are produced in Europe and other parts of the world. So time has come now for us to look inward. And I think I begin to like the conversation around vaccine development in-house. It's quite key. And then we need to also strengthen our university system. Ayo, let me share this with you. Time has come now for our universities to become entrepreneurial in nature. We should move from a paradigm shift of producing graduates that are for the labor market. What are the universities doing? I have checked across the country. There is no any university that has a knowledge transfer office. There is none. If you go to Texas State University, universities across US, they are declaring profits. Universities are supposed to declare profits, you know, in terms of patent knowledge transfer. So we need to move from the what is obtainable now and begin to make our universities entrepreneurial in nature. So that brings about changing curriculum, that brings about also seeing how we can be able to optimize and begin to move in time. We're in a 21st century that is a knowledge-based economy. And what we need to do as a country is about product and services delivery. So we need to typically move away from the narrative of being a typical university to we should be producing graduates that they don't care about the labor market, whether they need to work with government or not. They should set up their establishments of themselves and begin to set up companies. So that is the narrative that, so if I ask you, when last did you hear that University of Lagos produced something very novel, or the university I come from produced something novel?
I'm wondering, because right now we're seeing on the front pages of papers, federal government budgets $5.8 billion for vaccine institutes. You have a number of subliners there, why we can't develop vaccine, and so on and so forth, and how, you know, even people are wondering, this vaccine that the authorities say we're going to get, Nigerians are going to be vaccinated, hopefully in the first quarter of this year. A number of them should be vaccinated. People are saying the vaccine is scarce, and the ones that are up for production have already been bought beforehand. There are questions around that, which I'll have you answer in a moment. But I want to believe that, you know, there's also focus on the virus itself. This second wave was foretold.
Absolutely.
You know, even though, yes, we went back to our nonchalant ways after the lockdown. For a lot of people, after the lockdown, we felt the virus was over. But a lot of people warned about a second wave that could come upon us. Do we understand the nature of this virus today?
As a country, I can say that we have a minimal understanding of the nature. This is because I have gone through a lot of lexicon to check out publications, from Nigeria. I see quite limited. This is because a lot of professors, a lot of university lecturers are on strike. These are people that are supposed to, go...
Oh, they've called off the strike now, but they're not back at work yet.
Of course, they are not back at work. So we have not actually really understand the nature of the virus in-depthly. All what we know is that we are the first country to sequence this COVID-19 virus in Africa. Yes, we are also able to push to identify the variants of this virus that has mutated.
Yes. So are we sure that, is it the mutated virus that is now with us, or is it still the one from the first wave? Do we have an idea of the strain with us?
Actually, that's what I'm saying. So we have not actually really understand. So we need bioinformaticians to actually catalog that. We need public health modelers to actually catalog that. to actually also see which of the variants is in circulation in the country. We've not done that. So it has, we need a multidisciplinary approach to this. We need health economics to tell us whether we are spending more or we are spending less. We need to also go in depth into epidemiology to really actually understand. Dr. Tolu made quite a valid submission in a background. So we need to actually understand what is wrong with the change in human behavior. Is it attributed to socio-economic status of individual? Is it that we've not done well in risk communication and advocacy? So we need to do more. Let me share this with you. 10 to 11 months into this, we have very poor surveillance system at the grassroots. I was here some months ago and I said, we would have quickly set up a COP health marshal at the villages where people can be able to identify this. The COP marshals can be able to become health educators, be able to report. We've not done it. And we're in the second...
Largely because the local governments are not working. Absolutely.
The local government structure, we are talking about vaccine. I was happy when you engaged some of my mentors, Dr. Simon Agwale and Professor Audu last week. But you are talking about storage of -70. Where can you get that in our local government level? Our local government chairman keying into this to set up cold chain system on vaccine storage to strengthen our healthcare system. You see a local government chairman without a face mask, attending public gatherings. These are supposed to be policymakers. So actually there is no buying into this. And I think we need to do more. I got across 10 doctors. I casually asked them yesterday whether if the COVID-19 is available, they would take. They told me no.
The vaccine?
The vaccine. Even among the healthcare workers, there's no buying. So we need to do a lot of advocacy. We need to do a lot of, we need to really talk to people to really understand.
I'm going to ask you to hold your thoughts. When we come back from the break, I'm going to be asking you if, given all that you know about the COVID-19 virus, I mean the virus itself, the coronavirus, wondering if you've seen sufficient coordination from the PTF in passing across the message that Nigeria should be getting. But that will be in a moment. Please stay with us. Dr. Akiara Ishako is a virologist and a public health epidemiologist, and he's with us in our Abuja studios. Just before we went on break, I did say that when we come back, I was going to ask you that given all that you know about this virus, how it's mutating and how it easily spreads, because there are also questions as to whether this mutated virus, if that is what is with us, is it spread faster than, say, the strain we saw in the first wave. And all of this are all hypothetical here in Nigeria because we do not have confirmation of the type of virus that we have. Nonetheless, given all that you know about the behavior of this virus, maybe studying from what you have seen elsewhere, would you say that the PTF has its eyes on the ball with coordination efforts from the federal and among the states with the steps that it has taken and recommended so far?
So, Mwakwe, I want to give it to the Presidential Task Force. Excellent coordination in terms of policy, in terms of daily briefings. But where I have some kind of concerns are state governors have not buy-in into this. So you have policies from the PTF, and then when it comes to state level and local government level, it's been watered down. So we have classical policies on papers, but when it comes to implementation and enforcement, and I think...
Well, some people argue differently. They say some states that have felt the burden have taken steps. Give you instance, Kaduna, Ekiti.
And Lagos.
And Lagos.
So you can count, you count 3, 4 out of 36.
That we know, I mean, they're in the news. Maybe that's why.
I hope you know that the presidential PTF, state's supposed to model that. We're supposed to have state PTF, like a state task force, that's supposed to educate people daily. We also need to have local government PTF. That's supposed to, like a PTF model, that's supposed to, educate people daily. But do you see that in states? Do you see that? Lagos State just went and shut down nightclubs because actually night activities drive this virus. And they did a lot of things, charge people to court. Do you see that in other states? Except Kaduna State that does enforce. So enforcement in states is a bit poor. You see people walking without face masks. You see people, even policymakers, even governors attending burials, attending funeral services, attending weddings. And you begin to ask yourself, are these people that are saying that there should be no mass gathering attending? So you see that. So classical coordination at the top, but at the bottom, there is a kind of a weak implementation of these policies. Could you imagine, Mark, where as a presidential task force, we could not even coordinate people coming into the country to take their test? I was in this station, some months ago. I said, let us open a window for private sectors. Let us have an in-house testing panel in our airports. It does not take rocket science. You can have a gene expert that can analyze within 30 minutes to 1 hour, 20 samples at a time. If you have 10 of them, that's a flight, 200 samples. So somebody comes in, hey, can you just have 2 hours delay? We need to test you. And then you test it. So it's not a rocket science. If you cannot do that as a government, you open a window for private individuals. So policy implementation of these protocols is quite poor. I come from the university system. Our sick bays are nothing to write home about. Our healthcare system, health centers in our universities are not. Our hostels, you are talking of overcrowding your house. Our lecture theater, I take a class of about 600 students.
So you feel it.
I feel it.
In terms of this resumption date, you are smack right in the middle of it. You're aware of the danger of this virus, and you're also seeing the difficulty. I mean, I'm sure you understand that there is heavy thoughts on, weighing the education of children who have been at home for an extended period of time vis-a-vis reopening schools in the wake of a second wave. Where do you stand on that quickly?
So I stand in, let us reopen. These are my reasons. The same people we are asking them not to come to school, they go to the market, they go to mosques, they go to churches, they go to nightclubs that will open. They mingle. They are part of NSAS movement. They meet. Now, we should open up.
But within that, some people argue but that's within their age bracket.
Absolutely.
And they seem to have some resistance within that age bracket.
But the second variant.
But they could pose a threat to their lecturers and
absolutely.
elderly people.
The second variant affects 70% population. The transmissible dynamics is 70% among the young people. That is the second variant. But the issue is that let us reopen, but with strict adherence to safety protocols.
Do you think we can keep those?
So that brings to bear that how can a university system not be able to adhere to simple adherence protocol? So Mark, let me take you into this.
Before you do, let me quickly flip back to Ayo in Lagos, because I'm sure he has to get over to our guest on Zoom. Ayo.
Yeah, most certainly, Mark. Dr. Olufunlayo is still with us, Dr. Tolu Olufunlayo. There was a question you asked Dr. Ishaku that I think would be something also for her. She's also referenced it. Doctor, you referenced the fact that we need to interact with the locals a lot more. And you also heard Dr. Ishaku talk about the fact that we need to have the information mechanism or communication mechanisms to trickle down from the states to the local levels, to the ward levels and all of that. You have talked about the need for us to engage people, to get them to get the buy-in that is necessary to get this done. But without appropriate communication, you know how difficult it has been, just as you have said earlier, to rein people in, so to speak. Now, we're talking about a second variant. And as you said, we are yet to really understand what the issue is with the first variant. And now we have a second variant, and it seems to be evolving on its own. And as Dr. Ishaku said, among a young population. And now we're talking about reopening of schools. First of all, on the reopening of schools, where do you stand?
Okay, thank you for your question. I'm going to try to unpack this because it's loaded. You see,
I want
we
you
are talking
to
about this.
let's take it one after
Yeah.
the other, okay? Let's begin. First of all, where do you stand on the reopening of schools? Then we take the others in their bits.
Okay. Schools would need to reopen, but I think we have to, first of all, take a look at how well we can handle the reopening. One of the major problems with universities, of course, I am in the university system and I have been there for a long time, so I understand the problems. One of the major ones is overpopulation. So it is very difficult for you to practice physical distancing, especially within the classrooms and within the hostels. Of course, you know that people are coming from different parts of the country to come to school. So it's not like the primary or secondary education system, especially the primary, where people are coming just from one locality. They're going to be together for a long period of time. We don't have wash facilities working well in most of our universities. That is another major problem. So when you talk about hand washing, it's going to be a challenge. And then how are students going to be buying hand sanitizers that are so expensive the way they're supposed to buy them? So the universities, and this is, coming to the issue of university revitalization. And again, it is a symptom of the weak systems that we have. The education system has been very weak, and this is also exposing those weaknesses. However, I must tell you that for the tertiary resumption, some universities, have put on their thinking caps. They're trying to see what they can do. Some universities, for example, the University of Lagos, where I work, we are already looking at using virtual modes of teaching. I do not know exactly how it's going to be deployed, but we are being trained as we speak, or retrained, because we have been trained in the past, on the use of the LMS, the learning system. So these are things we need to move to the new normal of education, which is going to be a hybrid model. I can't see us coming back to being fully physical for various reasons, even because of the overpopulation of our universities. We definitely need to employ some virtual teaching methods in addition to the physical ones. Now, because I'm in medicine, there's some aspects of medicine you cannot teach virtually. Medicine is a bedside specialty. It's a bedside, thing. So we must have some of the physical, but I know that at least in the beginning, we're looking at how we can deploy it. So I think the universities will need some time to be able to decipher how best to reopen safely. I also heard in the report that, some universities are looking at a phased resumption. And I think that's very important. Because if you do that, then you won't have everybody coming in at once. That's one. Secondly, if you now find out that the resumption is causing spikes in cases amongst the, either the student or the staff population, then something can quickly be done before everybody is exposed. And I will recommend that to every level of education. When we do eventually decide to resume, we need to do it in a phased manner. Because people say, in the, when we resumed in September and October, that is the primary and secondary levels, we didn't see the spike of cases that we thought we would see. But now we have higher numbers of cases, and I suspect that we have much higher levels of community transmission, even though we don't have all the data to be able to pinpoint. So it's important for us to go back gradually so that if there are any spikes, we can quickly withdraw. And this brings me to the issue of data-driven decision-making. The association I belong to, that I chair, the Association of Public Health Physicians of Nigeria, is very concerned about the data that we have for COVID-19. We need to have more data, and the various stakeholders need to be able to come together to look at this data in aggregation so that we can make data-driven decisions. For example, knowing exactly what is fueling this second wave, second spike in cases, we are looking at some of the data as an association to see whether we can find areas that would be easiest to, areas where we can easily put in interventions, I would say. So not just blanket because, oh, it was Christmas and it was this time and, schools resumed. We want to actually try to see and try and pinpoint some of these things. So it's important that all stakeholders can actually rub minds and bring their data together so that, we can make informed decisions and be able to nip this pandemic in the bud as soon as possible.
Very quickly, still on education, but this time on educating the populace that you talked about, percolating the information about COVID-19 to the people as much as possible. While we are contending with COVID-19, we are still, we still have Lassa fever in view. Just this morning, a paper reported that 10 people have died as a result of cholera in Benue State, and a good number of people have been hospitalized. All of that we are contending with at the same time. Giving information out to people. What have we missed? And what should we quickly address so the figures do not continue to rise the way they are rising and giving everyone, especially the health workers and the authorities, serious concern?
Yes, thank you. And I'm glad you mentioned the fact that there are other communicable diseases that are killing Nigerians and affecting us adversely. The important thing is for us to, be able to have the buy-in of the community by using trusted persons to reach them. And as most of us know, there's a lot of distrust and mistrust between the government and the populace for various reasons. So the government needs to make use of leverage on those trusted people in the community. We have structures set up. We have the community development associations. We have the traditional rulers. We have, several systems there. We have respected persons in the community. Of course, we have some of our, important personalities, people in the media, people in entertainment also coming out to talk about COVID-19. But we need a stronger message, and we need to take it really down to the grassroots and engage them, not just talk to them and tell them what it is, but actually engage and understand their thought pattern, and where we may have missed it in the past. We need to be able to tell them, look, we thought it was this way, but now this is the way we are seeing it, and give them the actual picture. So our risk communication must change. It must become more people-centered and more people-driven. When we do that, unfortunately, it might take time. But, a journey of 1,000 kilometers begins with a step. If we start today, we are going to be getting closer towards getting our people mobilized and then getting them to accept that there is something they need to do. They need to take responsibility for protecting themselves and other people in this pandemic.
Oh, Dr. Ishaku is still with us. I'm sure you wanted to respond to a few things that she raised there. She talked about how, the students might find it a little difficult to cope with some of the demands that will be required for returning to school. And I heard you say something here in Abuja. You already did say that the universities will have to be entrepreneurial in their thinking if the students are going to come back to school. Do you want to quickly respond to that?
Yeah. So, Malkwe, assuming that I'm a vice chancellor of a university and I want to reopen, so I want to appreciate Dr. Tolu's position on the face-to-face reopening is quite key. So if I have 40,000 students in the university, I can be able to raise 2 billion naira for you. Now, let's say you are going to resume in phases, but this is the portal. You will pay in 5,000 naira. I'm just assuming you will pay 5,000 naira. We will run COVID-19 test for you on arrival. We will run your blood group. We will run maybe your genotype. We will sell products to you.
Is that going to be done within the university?
It can be done within the university, the health center. So you have it in phases. And then multiply 5,000 by 40,000 students.
And you will not, that the unions will not complain that you're increasing their burden without commensurate
absolutely, you need to protect
remuneration.
You need to protect the health well-being of the system, of the university, of the students. 5,000 naira, you know. When you go to our university centers, there are no medical records for students. So if you do that, you create a medical record, right? You have 2 billion naira. Multiply 5,000 naira by 40,000 students. You have 2 billion naira. You can set up, increase hospital beds, have a section of the hostel dedicated as an isolation center. Should in case people that are positive, they will go in there. Mandate chemistry department of the university to produce hand sanitizers. You can talk in with them. Mandate entrepreneurship unit or department of the university to produce customized face masks. You can mandate petrochemical department of the university to produce hand washing bowls. You can mandate mass communication department to go into advocacy, come up with innovative ideas that can be able to drive this process. They understand the system.
So there is a role for everybody. The question is, that's at the university level. But oftentimes when they talk about resumption, they're talking about, in general. You have the children in primary schools. You also have secondary schools as well.
Absolutely.
What's going to happen there?
Absolutely. So you can design models to accommodate that. I have kids in school, and I went to the PTA meeting, and I told them, we are going to pay for COVID-19 tests. If you use a rapid diagnostic kit, which I think the government said they will roll out, which is quite key.
Well, I do hope that members of the PTF are listening and watching this morning, and Nigerians who will be in position of authority to make certain policy decisions on this matter. I hope that they have been able to take something away from the conversation we've had this morning. We have to thank you very much for coming on Sunrise Daily. Dr. Akiala Ishako is a virologist, a public health epidemiologist. We also had with us on Zoom from Lagos, Dr. Tolu Olufunlayo, who is a consultant public health physician. We thank all our guests for coming on Sunrise Daily this morning and sharing their very candid thoughts with us.